Imagine waking up with your legs feeling heavy, swollen, and painful. Every step you take feels like you're dragging weights. It's not just uncomfortable, it could be a sign of something much more serious. Hi everyone, I'm Cassandra, a wound care physician, and today we're going to dive into leg edema, why your legs swell, and what are the potential health consequences if left untreated. Stick with me for the next few minutes as we uncover the causes of leg edema, the potential complications that you must know about, and simple, proven effective ways to reduce leg swelling, also known as leg edema. This is crucial information, especially for those who are experiencing chronic leg swelling and those who are at higher risk of developing wounds. Let's get started. Leg edema, or leg swelling, occurs when excess fluid builds up in the tissues of your legs. It can affect one or both legs and can range from mild to severe. This fluid buildup is often the result of an underlying condition, so addressing the root cause is essential for managing this condition. Also important to note, if you experience sudden pain, redness, and swelling in one or both of your legs, it could be a potential sign of a condition called DVT, which you should address immediately. Please seek immediate medical attention and do not ignore these symptoms. Now, with leg edema, there are several potential causes, including heart failure. So with heart failure, your heart has difficulty with pumping fluid throughout your system effectively. And when that happens, fluid accumulates in your lower legs. There's also a condition called chronic venous insufficiency. Now, with this condition, the veins in your lower legs fail to bring fluid and blood towards your heart effectively, and this leads to fluid accumulation in your legs and the leg edema. Kidney disease is also another potential cause. So when your kidneys fail to remove fluid out of your body, that can increase your risk of, again, fluid accumulation and edema. Certain liver conditions like cirrhosis can disrupt fluid regulation, and that also leads to fluid buildup and swelling. You also have lymphedema, which is a condition within the lymphatic system where the lymphatic system is compromised, and again, that leads to fluid buildup. Finally, certain medications like those for your blood pressure and diabetes can potentially have side effects like fluid retention, leading to the leg edema. If left untreated, leg edema can lead to serious complications. Persistent leg edema can lead to breakdown of the skin, which increases your risk of developing chronic wounds. So this is why I tend to focus on trying to really manage leg edema as part of wound care. So with this breakdown, it can increase your risk of developing infections like cellulitis and also chronic wounds like venous ulcers. And on top of all that, severe edema can really affect your ability to move around, and that just affects your quality of life. Managing leg edema involves addressing the symptoms and addressing the underlying cause. Here are some strategies that you can use. Leg elevation is one of the simplest yet most effective ways to reduce leg edema. By elevating your legs above your heart for about 15 to 20 minutes a day goes a long way. Doing this a few times a day encourages gravity to drain the fluid back towards your heart. You can do this while lying down with your legs on pillows or when you're in a reclining chair. Elevation can significantly improve circulation and relieve discomfort. Wearing compression stockings are also pretty effective. Compression stockings work by applying gentle pressure to your legs, and that encourages the fluid and blood to move towards your heart and reduces fluid buildup in your legs. Now, these stockings come in different pressure levels, so it's important to be seen by a provider to get the appropriate fit for yourself and proper compression level. I would recommend wearing them during the day, but taking them off before you go to bed, unless you're directed otherwise by a physician. Staying physically active is super important. By staying physically active, you are improving the circulation, which helps with reducing that leg edema. And simple exercises like walking and biking and cycling, they can all help pump the fluid out of your legs. And if you're not able to do those exercises, even things like leg lifts, ankle rotations, and calf lifts while you're sitting or standing are all super effective. Even light activity during the day helps prevent blood pooling and keeps the blood flowing. Limiting salt intake, if it's okay with your medical provider, can also help with reducing swelling. So too much salt in the diet can lead to retention of fluid within your body. Reducing your salt intake can help with reducing the fluid buildup in your legs. I generally like to focus on eating fresh fruits and vegetables and avoid processed foods because they tend to have a higher salt content. So if you're going to eat anything that's packaged, I would recommend looking at the labels to see the salt content and adjust as necessary. Staying hydrated can also lead to controlling your leg edema. Now, it may sound counterintuitive, but the way that this works is when you're dehydrated, your body has a tendency to want to retain fluid. So maintaining adequate hydration is good for kidney health because it helps with supporting the filtration of fluid in your body. Now, the amount that's recommended to you may differ based on what your provider recommends and based on your medical conditions, but I generally recommend about 6 to 8 glasses of water, and those glasses are about 8 ounces per day. And sometimes you may need the help of medications that help with expelling that extra fluid out of your body, depending on the kind of medical condition you have. So a couple of specific conditions where you might need medications to help with controlling the leg edema are heart failure and chronic kidney disease. So in these situations, proper medical evaluation and treatment is essential. If you currently have leg edema, keeping the skin well moisturized and monitoring for any sign of breakdown of the skin is super important, especially if you're more prone to developing wounds. Remember, managing leg edema isn't just about treating the symptoms, it's also about addressing the underlying cause. So if you notice persistent leg swelling, it is important to talk to a healthcare provider to evaluate for potential underlying causes and develop a good treatment plan. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe to get more wound tips and healthcare advice. And if you have any questions or personal experience with leg edema, I would love to hear about it, so drop them in the comments below. See you next time, and heal well.